This HAN Network video is brought to you by Carl Chevrolet.
All right, well, now we're back with your coffee break, and I'm excited to welcome some guests from Griffin Hospital. Daun Barrett, who is the director of the Griffin Hospital Community Outreach and Parish Nursing, and Cathi Kellett, who is the Griffin Hospital CPR Training Center coordinator. Ladies, welcome. We're so excited to have you here. Just want to talk a little bit about the CPR Training Center. Can you tell us a little bit about how that got started, Daun?
First, I'd like to thank you for inviting us here, since we're, as parish nurses, very passionate about training in CPR. It was about 1997, and there was a group of us who wanted to train our parishioners in CPR, so we called to find a program that could come in. It was cost prohibitive. They were charging $65, $55 a person. So 5 of us got together and said, we'll become instructors. And the rest, they say, is history. We went on to become instructors with the support of three very good churches: Assumption in Ansonia, First Baptist Church in Seymour, and then the Seymour United Methodist Church. All supported us and sponsored us to take the training and paid for all our mannequins and stuff we needed. So then we began training the churches by training the churches. Now we have progressed to over 50. We progressed from being just training under St. Rayfield's to our own training center. And that only took a few years because we were training so many people. But now we have some 50 instructors, and they are community volunteers that help in the community train. We train over 4,000 people a year. So, and, you know, that's a lot of training, but we're very passionate about it. We train in things like friends and family, which Cathi will be demonstrating, which is for the lay person. And it can be a hands-only, or it can be, you can learn the breathing techniques. We also do basic life support. We do, one of our big ones is the CPR AED training that we do. And that's where everybody has an AED, which we oversee now at this point, 89 AEDs in our community.
Wow.
So we do have a lot in the community.
Now, Cathi, let me ask you. We have Cathi set up ready with the dummy. She's going to demonstrate. She's going to demonstrate for us in a bit. But Cathi, I mean, I've been hearing a lot now about hands-only CPR and how this is something much easier that people can learn and not feel intimidated about, you know, the breathing and mouth-to-mouth contact. Can you tell us a little bit about it?
That's correct. Most cardiac arrest happens in your family, out of the hospital, with your friends, your coworkers. So the big push was compressions work. We need to pump that oxygen-rich blood around, keep them alive until advanced care can get there, EMS. So the American Heart Association back in 2010 designed the Family and Friends course, where it was basically recognize there's a problem, send somebody to call 911, and start compressions. Remove the shirt and just hard and fast doing compressions. When you collapse, you have some oxygen still in you. So this is what you're going to pump around, and it'll buy you enough time till that advanced care gets there.
Right.
It takes the fear out of people saying, oh, you know, I can't put my mouth, I can't do mouth to mouth. Well, you know what? In the first few minutes, you can just do compressions, and that's what's going to save people's lives.
Right. And now, Daun, let me ask you, I mean, you know, there's something, if you're ever in that situation with a family member in an emergency like that, cardiac arrest, you can feel so helpless. And really kind of having this knowledge is power. It really is.
It is. And the nice part is a lot of times we panic and you forget everything. But when you call 911, the dispatchers have their little book in front of them, and they will ask you, do you know CPR? And we had this happen where we heard the story, one story, the woman said, I learned CPR, but I don't remember it. He says, okay, let's start. And the minute he started, she remembered. And she did it, and she saved her husband's life.
Wow.
So, you know, the dispatchers are critical, and it really is. It's so simple. Once you learn, we are the only hope that somebody has when they collapse. So, like I said, we feel passionate about everybody knowing CPR.
Yeah. And I know you guys offer this training regularly. You do it how often? Once a month or so?
Yes, we do it once a month. It's
We offer the second Saturday of every month free, non-certifying family and friends CPR training. We also offer the certifying training companies and folks that need it, but we really are pushing this free training, and we do it for scout groups and kids in schools and anybody that wants to learn.
And we train the Boys and Girls Clubs. We train, you know, all for free, because we feel this is very important important for people. But I think the Saturday one, what we want to stress is it's free. It's the second Saturday of every month. They need to call, and I hope we'll have a number up there, Cathi, to register, because we need to know the number of people being trained so we can have enough instructors.
Right. And let me just give the number now for anyone watching. So you can register for that by calling 203-732-1337 to sign up or just get more information, because space is limited since it is a free program, which is such a great offering in the community. And I mean, heart disease and those issues are a growing problem that we're seeing. I mean, it's a major medical issue, right?
The heart disease is, but I think that the fact that learning CPR and what we did a major push a few years back, training 6th and 7th graders with the CPR Anytime. When you look at heart disease, we have about 100 out-of-hospital cardiac arrests a year that go to Griffin. They may go someplace else. And out of that, we were seeing a survival rate of about 4 to 6%. When we did this 4-year push, it actually rose to almost 45% survival rate because people were initiating CPR. So yes, heart disease is on the rise. Hopefully through education, we can stem a little bit of that, especially with our youth, which Cathi does a lot of programs with the youth on wellness and exercise and diet. So
Now, Cathi, what are you going to demonstrate for us?
If somebody collapses and you come upon the scene, we want to recognize scene is safe. We're going to tap and shout, try and check for responsiveness. Are they breathing? Can we wake them up? If not, send somebody, if they're around you in the blue, go call 911, go grab an AED if there's one. Lift the shirt, and then we're going to go through how to do compressions. We do 30 compressions. If you have a barrier device, you would pause and do your 2 breaths, the ventilations. If you didn't, you get to 30 and you just keep going. You just keep doing hard and fast compressions until someone else arrives to help you out.
Great. All right. Can you demonstrate that for us, the compressions? Awesome.
Okay, so we come upon our victim, making sure our scene is safe. Tap and shout, hey, are you okay? Are you okay? Is there any breathing? No, you in the blue, go call 911. Grab an AED. Lift the shirt so we can get as close contact to the skin. Find the center of the breastbone, out or below, and we're going to compress down. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I have my barrier device. I'm going to give 2 breaths. And we're going to go back to 30. And we're just going to keep doing this until, like I said, that help arrives.
And I know people are often scared, especially on an elderly person, of perhaps cracking a rib or something like that. Can you talk a little bit about that and how it's just important to keep the compressions going? Dawn, do you want to discuss that?
yeah, I'll answer that. What we tell people when we train them is the person is basically dead. So a cracked rib is not going to make a difference. What you want to do is you want to keep that oxygen going. The cracked rib will heal.
Right.
Okay, or any other complications. But if you don't do it, it doesn't matter.
And I know a lot of, I've seen at least in Trumbull and some other local EMS have been trying to get those machines that actually do the compressions for them, which I know is a great tool, but also expensive.
Right.
And I mean, even these training dummies, I know you guys need support in order to, get those. Yeah. Is there any way that people can kind of support you guys or get involved?
I think the biggest support we need is people getting trained. We do have an initiative. It's called CPR Anytime, and that was the initiative we did in the schools. And the CPR Anytime kits we got them through grants, and they were phenomenal. The kids could take them home after they were trained, and it was a take-home kit where they trained 3 or 4 other people. So we trained thousands of people just with one kit, and they're very expensive. So that would be a way to help, and we were hoping for maybe some corporate or company support with that with the schools.
Right.
To go into the schools.
Right, and I know getting more AEDs out and around the community is important. Cathi, do you want to speak to that at all?
Sure. We had found doing CPR is great. It's saving lives. Adding that fast AED is saving even more lives. Very simple to use. Turn it on, open it up. And they start to talk to you right away.
Remove all clothing from patient's chest.
You forgot to take the shirt off. It just reminded you. you look at the pictures. If you're not sure, they show you exactly where they go.
Pull red handle to open bag. Look at pictures on
As soon as they
do not
sense
touch
they're in the
patient.
right spot, everybody clear. It's going to analyze.
Heart rhythm. Stand by.
Everybody clear.
Preparing for shock. Everyone clear. Press flash.
Everybody clear. Hit the button. Body jolts a little bit. It didn't work, so it tells you right away, go right back to CPR, leaving the pads in place. It's now going to time you for 2 minutes, so you just have to keep track of compressions, breath, compressions, breath. At the end of 2 minutes, the machine's going to say stop, analyzing, see if we got the person back, if it needs to give another shock. Very, very simple to use. They're out there. We're heart-safe communities. That means there's public access defibrillators in all of our nonprofits, town halls, schools, Boys and Girls Clubs,
Churches.
libraries, churches. Our churches bought into these. We got a phenomenal grant from the American Heart Association to place our original, 50 some odd ones. The community buys into it. We're seeing survival rates go through the roof. We want to see them go even higher.
That's just incredible. And ladies, like we said, if this happens to you, it's a high stress situation, but having that training and taking advantage of those free training sessions can just give you that peace of mind.
And one of the things, the critical things with the American Heart years ago decided that, remember how you used to always have to check for a pulse, check to see if they were breathing and everything? They found that 50% of the time lay people found a pulse when there wasn't, and the other 50% of the time they didn't find a pulse when there was one. So they bypass that. If you don't see any movement, if you can't get somebody to respond, you start the chest compressions. You cannot hurt them by starting chest compressions, even if they have a heartbeat. Okay? So.
Now, Cathi and Daun, so for people, again, that want to get information about this, griffinhealth.org is probably a good source, good way.
Yep, and our phone number and email to contact the training center is on griffinhealth.org.
Great. Great. Thank you so much, ladies, for coming in and talking about this. It's a really important health topic, and we're grateful.
Well, thank you for having us. We feel very
having us.
passionate about it, too.
All right.
Thank you.
Thank you so much,
Okay.
ladies.